Hi everyone, welcome back to SG Doctor Wellness. My name is Dr. Chen Yiming. I have produced a video on the Pfizer and Moderna COVID-19 vaccine which I've uploaded on the 28th of December 2020. If you haven't seen that yet, click on the top right of the screen now. If you're new to our channel, click on the subscribe and notification button. Since then, thousands and thousands of medical healthcare workers and frontliners in Singapore have already gotten the vaccinations. I'm happy to say that I myself have already gotten my 2 doses. The first one was on the 14th of January 2021 and the second dose on the 4th of February, exactly 3 weeks apart. I got the Pfizer vaccine. And no, I haven't grown a third arm, neither am I glowing in the dark. Now, many of my patients asked me a few questions after they realized I've done my COVID-19 vaccine. Interestingly, these few questions kept on repeating itself, meaning many different patients asking me the same questions. Interested to know what they ask? You want to know how I felt after the vaccine? Did I suffer any side effects? So let's get into it now. Well, how did I feel after the vaccine? Honestly, I felt the side effects of the second jab more than the first. There was really no pain when the injections were done on both occasions. So great job by both the nurses who did the vaccine for me at Punggol Polyclinic. However, in both doses, I actually felt soreness of my arm, some redness and swelling which lasted for about 2 to 3 days. No big deal. I went for my regular runs, I did some pull-ups and push-ups and the pain went away soon enough. However, for the second dose, I actually felt quite a bit of chills and body aches about 24 hours after the vaccine, but they lasted only for about half a day. So what are some of the other side effects that you may expect? Apart from the arm soreness and redness and swelling that I experienced, some patients do develop swollen lymph nodes on their neck or armpits. One of my clinic assistants actually had a swollen neck lymph node which went away. Another of my clinic manager got a fever on the second day after the jab. She also recovered uneventfully after some Panadol and a day's rest. About 14% or 1 in 7 patients developed fever, and many felt body aches and joint pain, more so after the second jab. So of course, the most feared side effects of all was allergy. So with all forms of external agent that we input into our body, there are always risks of allergy. We can get allergies from Panadols, we often get allergies from antibiotics, we even have allergies from food. Does peanut allergy sound familiar? So it's not surprising for the COVID-19 vaccine to cause allergies as well. But what we need to watch out for are the really serious allergies such as swelling of the face and airway, allergy-induced severe drop in blood pressure and cardiovascular collapse, respiratory distress as a result of the allergies. So in Singapore, we have a nice system of having all patients sit at a waiting area for about 30 minutes after the jab to watch out for the serious immediate allergies. We've seen a few of them, but they have all since recovered fully. So the top question that all my patients asked me when they knew I had the vaccine was, "Oh, you've done it already? How did you feel, Dr. Chen?" The second question that they've always asked me was, "Hey, Dr. Chen, should I get my parents vaccinated? They're already so old and they hardly travel out of the house." Now, elderlies tend to suffer from chronic medical conditions like hypertension, diabetes, heart conditions, and even renal impairments. With more chronic conditions, your chance of falling very ill from COVID-19 becomes much higher. While it may be true that your elderly parents don't travel much, it's unavoidable that people may still visit them at their house. It's unavoidable that they will need to buy groceries at the supermarket. While again it's true that the community cases in Singapore are low, it's not zero. Therefore, for their sake, please convince them to get the vaccine done. And on that same note, to get yourself vaccinated too, to reduce the chance of you spreading to your loved ones. The third very common question that I get asked a lot was, is it safe for me? I'm really worried about the side effects. Well, this is a vaccine that cost billions to research and develop, and now produced and used by millions and millions of people worldwide. The evidence shows that it is safe and it's effective. So please go for it as soon as you can. However, just to highlight a few groups of patients that should not get the vaccine done. Children less than 16, pregnant ladies, patients who have a history of severe life-threatening allergies from other medications or food, or even from the first dose of the COVID-19 vaccine, patients who have a much weakened immune system from medical conditions. When in doubt, please consult your family doctor on your suitability. I'm sure we're all more than happy to help answer your queries. So I hope that this video can educate you more about the side effects of the COVID-19 vaccine. The side effects are very much the same as all other vaccines that we have been using for years. Trust the science, take the vaccine, and stop the pandemic. Do it for your loved ones, do it for the frontliners. Subscribe and click on the bell button to be notified whenever we produce a new video. Till the next time, stay safe, stay healthy.